Now let's go to coordination of benefits with Medicare. Coordination of benefits with Medicare is a process that ensures proper management of healthcare costs when individuals have multiple sources of insurance coverage. Medicare serves as the primary payer in most cases, while other insurance such as employer-provided coverage as the secondary payer. The coordination of benefits process prevents overpayment and ensures that the appropriate insurance coverage is applied for medical services and prescription drugs. With coordination of benefits, it is crucial to provide accurate information about all insurance coverage to healthcare providers, pharmacists, and insurance companies. This enables accurate billing and ensures that claims are processed correctly, minimizing out-of-pocket expenses for the individual, of course, you as a Medicare beneficiary. Coordination of benefits rules may vary depending on the specific situation and insurance plans involved. It is advisable to review the terms and conditions of each insurance plan, consult with your insurance provider, or seek assistance from healthcare professional or insurance specialists to fully understand the coordination of benefits process and optimize your coverage. Well, I'm going to give you some scenarios where you have Medicare coverage and other health insurance. For example, you are 65 years or older and have group health plan coverage based on your spouse's current employment status. So, when you turn 65 and you have group health plan coverage based on your own or your current spouse's employment status, Medicare determines whether it acts as the primary payer or the secondary payer. If the employer has 20 or more employees, the group health plan generally pays first, and the Medicare becomes secondary payer. In this case, the group health plan provides primary coverage for your medical expenses, including your doctor visits, hospital stays, and prescription drugs. If the employer has fewer than 20 employees, Medicare typically becomes the primary payer, and the group health plan serves as the secondary payer. Medicare will cover your eligible medical expenses first, and then the group health plan will provide secondary coverage for the remaining costs. Well, it is important to note that the coordination of benefits may vary depending on your specific group health plan's terms and conditions, so it is advisable to review the plan's documents or consult with your employer's benefits administrator for clarification. Well, to ensure proper coordination of benefits, inform both your employer and the Medicare about your eligibility for Medicare once you turn 65. This allows the claims to be processed correctly and ensures that the appropriate payer is billed for your medical services. Well, if you have any questions or concerns about coordination of benefits with Medicare and the group health plan, it is recommended to reach out to your employer benefits administrator or consult with Medicare representative who can provide guidance tailored to your specific situation. Next, we go to HMO plan or employer PPO plan that pays first, but then you get services outside the group health plan's network. If your employer offers both an HMO and a PPO plan and you receive services outside the group health plan, the coordination of benefits would typically depend on the specific terms and conditions outlined in your employer's plans. In most cases, PPO plan is designed to offer more flexibility in terms of choosing healthcare outside of the plan's network. If you seek services outside the group health plan, the PPO plan would generally be the primary payer and provide coverage according to its terms and conditions. The HMO plan, which typically requires you to receive services within its designated network, would likely act as the secondary payer for services obtained outside its network. Probably they would even pay, Depending on the specific HMO plan, it may offer limited coverage or no coverage at all for all services received outside its network, except, of course, for emergency situations. To ensure proper coordination of benefits and determine which plan pays first, it is essential to review the plan documentation, including the summary of descriptions and any coordination of benefit guidelines provided by your employer. If you have specific questions or need further clarification, it is advisable to contact the insurance provider or consult with your employer's benefits administration for accurate and personalized guidance based on your employer's plan. Then next we go to 65-year-old disabled, retired, and have group health coverage from family members' current employer. Well, for a 65-year-old individual who is disabled and has Medicare coverage, but also has insurance from a family member, coordination of benefits is essential to maximize coverage. In most cases, Medicare will be the primary payer and the health insurance from the family member's plan will be the secondary payer. This means that Medicare will cover eligible expenses first, and the family member's health insurance will cover any remaining costs. It is important to inform both Medicare and the family member's health insurance provider about your dual coverage. Healthcare providers should be provided with both insurance cards to ensure accurate billing and coordination of benefits. By coordinating benefits effectively, individuals can access a wider range of healthcare services while minimizing out-of-pocket expenses. Consider whether to enroll in an additional coverage such as Medicare Advantage Part C or prescription drug plans Part D. Access healthcare services covered under your family member's employer-based group health plan as the primary payer. Follow the plan's guidelines for seeking care, including using in-network providers, obtaining referrals if required, and paying applicable co-payments or co-insurance. Remember, specific coordination of benefits process may vary depending on your group health plan and Medicare coverage. It is advisable to contact your family member's employer or the insurance provider as well as the Medicare for professionalized guidance and to clarify any questions regarding the coordination of benefits specific to your situation. Then we go to the fourth slide. This might happen to you, wherein accident where no fault liability insurance is involved. When an accident occurs where no fault liability insurance is involved, coordinating Medicare benefits becomes important to ensure appropriate coverage for medical expenses. In such cases, Medicare serves as the primary payer while the no-fault liability insurance acts as the secondary payer. To coordinate benefits effectively, it is crucial to inform both Medicare and the non-fault liability insurance about the accident and the resulting medical expenses. Promptly report the accident to Medicare and provide any necessary documentation such as accident reports or insurance claim information. Medicare may make conditional payments for accident-related medical expenses covering the cost upfront with the expectation of reimbursement from the no-fault liability insurance settlement. It is important to keep Medicare informed about any progress in the process claims and provide details of any settlements received. It's worth noting that Medicare has the right to seek reimbursement for the medical expenses if paid settlements or judgment is obtained from the no liability insurance. Be sure to address any reimbursement requirements and follow the proper procedures to satisfy Medicare claims. Working closely with both Medicare and no-fault liability insurance provider is essential to ensure that medical expenses related to the accident are appropriately coordinated and covered. Timely communication, accurate reporting, and compliance with any reimbursement obligation will help facilitate a smooth coordination of benefits process. Consulting with an insurance professional or legal expert familiar with the specific regulations and requirements in the jurisdiction of a can provide further guidance on coordinating Medicare benefits in an accident involving no-fault liability. So here's the situation. You have Medicare due to the end-stage renal disease or ESRD and group health plan including retiree coverage. So when a Medicare beneficiary has end-stage renal disease or ESRD and also have a group health plan including retiree coverage, coordination of benefits becomes crucial. In most cases, Medicare becomes the primary payer for individuals with ESRD regardless of any coverage they may have. Medicare will generally cover expenses related to ESRD treatment such as dialysis services, kidney transplant, and certain medications. The group health plan, including retiree coverage, typically acts as the secondary payer. It may cover health care services unrelated to ESRD, such as routine checkups or treatments for other health conditions. It is important to understand the coordination of benefit rules specific to your group health plan and retiree coverage, as they may have different guidelines for coordinating with Medicare. Well, to ensure effective coordination, inform both Medicare and your group health plan about your dual coverage. Provide them with accurate information and necessary documentation. Healthcare providers should be made aware of your Medicare coverage and your group health plan so they can appropriately bill the primary and secondary payers. Well, in some cases, the group health plan may require coordination with Medicare through the process known as coordination of benefits or subrogation. This means that the group health plan may seek reimbursement from Medicare or expenses it covered as the secondary payer. It is important to keep detailed records of medical treatments, bills, and payments from Medicare and group health plan. This documentation will help you in case of coordination issues or reimbursement disputes. Staying informed about any changes to your group health plan coverage, Medicare benefits, or coordination of benefit guidelines is also crucial. To navigate the coordination of benefits process effectively, it is advisable to contact your group health plan administrator, retiree benefits administrator, and Medicare directly for professional guidance. They can provide specific information based on your individual situation and help ensure that you maximize your coverage while minimizing out-of-pocket costs. Next, we go to the next slide. Medicare and and veterans benefits. Well, coordinating benefits between Medicare and the Department of Veterans Affairs or VA is important for individuals eligible for both programs. When a person has both Medicare and VA coverage, it involves understanding how the two programs work together to provide comprehensive health care coverage. Medicare, of course, is a federal health insurance program primarily for individuals age 65 and older, as well as those with certain disabilities. The VA, or the Veterans Affairs, on the other hand, provides healthcare benefits specifically for eligible veterans based on their service-related criteria. In most cases, Medicare serves as the primary payer while the VA acts as the secondary payer. It means that Medicare will cover eligible healthcare services first, and the VA may cover certain services that Medicare does not fully cover or service-related conditions. Well, to coordinate benefits effectively, individuals should inform both Medicare and the VA about their dual coverage. It is important to ensure that both programs have accurate and up-to-date information about your enrollment and any changes in eligibility. When seeking healthcare services, it's recommended to use the appropriate program based on the nature of the care needed. For service-related conditions, it's often best to seek care from VA facilities, as they specialize in treating veterans' specific healthcare needs. And for other healthcare services not related to service-connected conditions, Medicare should be utilized as the primary payer. It is important to communicate with the healthcare providers about their dual coverage to ensure accurate billing and coordination of benefits. Providers need to be aware of both Medicare and VA coverage to appropriately bill the correct payer for each service. Staying informed about any changes to Medicare and VA benefits and maintenance detailed the records of medical treatments, bills, and payments are crucial. Regularly reviewing plan documents and communicating with both Medicare and the VA will help you understand any updates or modifications or the coordination of benefits process. While the coordination of benefits between Medicare and the VA can be complex, reaching out to both programs directly or seeking assistance from their helplines can provide personalized guidance based on your specific situation and ensure that you receive the maximum healthcare coverage available to you. Now let's go to our Medicare question and answer portion, and this was sent to me. Well, can you explain the appeals process if there is a dispute regarding coordination of benefits between Medicare and my other insurance? Well, the appeals process can be helpful if you encounter a dispute regarding coordination of benefits between Medicare and your other insurance coverage. Here is a brief explanation of appeals process. First, review the explanation of benefits, or EOB. Carefully review the EOB statements from both Medicare and other insurance provider. Understand the payment decisions and any other denials or discrepancies. Second, contact the insurance provider if you believe that the error or disagreement in the coordination of benefits. Contact the insurance provider responsible for the denial or incorrect payment. Request clarification on their decision and provide any supporting document or information to support your case. Well, file an appeal. If you are dissatisfied with the insurance provider's response, you have the right to appeal. Follow the specific appeals process outlined by the insurance provider. This typically involves submitting a written request, especially the reasons for the appeal, and providing any additional evidence or documentation to support your case. Well, utilize Medicare appeals process. If Medicare is involved in the dispute, you can also initiate the Medicare appeals process. This involves following Medicare-specific guidelines for filing an appeal, which can vary depending on the type of Medicare coverage you have. And of course, seek assistance. If you find the appeals process complex or challenging, consider seeking assistance from a Medicare counselor, patient advocate, or legal professional specializing in healthcare issues. They can provide guidance, help you navigate the process, and advocate on your behalf. And of course, follow the timeline. Be mindful of the appeal deadline specified by the other insurance provider or Medicare. Failing to adhere to that timeline may result in the loss of appeals rights. Remember, the appeals process is designed to resolve disputes and ensure that you receive appropriate coverage by advocating for yourself and following the necessary steps. You can work towards a resolution regarding the coordination of benefits between Medicare and your other insurance coverage. Oh, it's time to wrap up my show. I'd like to thank everyone involved in this episode, to our production team for making this episode possible. I would like to extend our heartfelt gratitude to our guest pharmacists for joining us today and providing the valuable information on the coordination of benefits with Medicare Part D. His expertise and the insights had helped our audience better understand the complexities of navigating Medicare Part D and optimizing their prescription drug coverage. Your dedication to ensuring the well-being of the patients and helping them make informed decisions is truly commendable. Well, thank you for sharing your knowledge and expertise with us, Math. And they will, of course, they will ask an autograph when they visit the ASP pharmacy. I was able to cover the topic of coordination of benefits with Medicare, and we hope that the information I provided has been helpful in understanding how Medicare interacts with other insurance coverage and the importance of coordinating benefits effectively. Remember, coordinating benefits ensure that you receive the maximum coverage available and minimizes out-of-pocket expenses. If you have any further questions or need assistance, don't hesitate to reach out to Medicare or your insurance provider. Stay informed and empowered to make the most of your healthcare coverage. Remember, if you have further questions or need more information about Medicare or any other Medicare-related topics, don't hesitate to reach out to me as a licensed insurance agent. Stay informed, take control of your health decisions, and remember that knowledge is power when it comes to managing your Medicare coverage. Join me again next time as we continue to explore essential topics impacting your healthcare landscape. I would like to send my love, hugs, and kisses to my clients. And to those who are looking for a reliable sales agent, I am here to be of service to you. Take care of your health. That is the only one you got. This is Maria Garcia of Maria Care signing off for now. Let's join hands to a better health.